Joining us is vein expert Dr. David Calcagno with how pregnancy can actually cause vein problems. Oh, pregnancy can cause so many problems, and now we're talking about this. So Mother's Day is this Sunday, so it's a good time to be talking about this because, as you say, this really is a problem.
Yes. Well, first of all, I'd like to wish all the mothers out there a happy upcoming Mother's Day.
Yeah.
And we all appreciate all the sacrifices they make and misery they endure. Unfortunately, varicose veins is another thing on that list.
Gosh.
About a third of women during pregnancy develop varicose veins.
Oh, man. Another thing for me to look forward to, huh? So why is that? A third of women, why does it happen?
There's several factors. One is hormonal. One is that the fluids in the body increase during pregnancy. And lastly, the enlarged uterus can press on the blood flow return from the legs, increasing the vein pressure.
Wow, this is really news to me. A third of women, that's a lot. What you just told us, how do they really contribute to what's going on there?
Well, from a hormonal standpoint, estrogen, progesterone, and relaxin are three of the hormones of pregnancy. And while, of course, they facilitate a good normal pregnancy and delivery, they can also soften the collagen, which makes up the vein walls, causing the veins to stretch and cause varicose veins.
So then, you know, being that you're here with me, I'm just going to tap your brain a little bit because I have not had children yet, but I plan to. So is there anything I can do that will prevent this from happening?
There's really nothing to prevent varicose veins from forming, but if pregnant women do suffer from varicose veins and the legs get tired, heavy, achy, there's several things they can do. One would be to use compression stockings, which helps counteract the high vein pressure. Also, elevating the legs would accomplish the same thing. Lastly, because the large uterus compresses the inferior vena cava, and the inferior vena cava is toward your back and a little to the right.
Okay.
If you lie on your left side while you sleep, it unloads the vena cava and allows the blood to return better from your legs.
So your left side, okay, remember that. Left side, ladies, left side. What if I, have one child, this happens, but I'm planning to have more children? Should I just kind of almost suck it up and be like, okay, I'll deal with this after I'm done, with my family? Or is it something that I should have worked on while I'm still doing that?
Well, we used to think that people should wait till they're done with all their pregnancies, but the current thinking is that if you were bothered by varicose veins during one pregnancy, the subsequent pregnancies are going to be worse and worse and worse.
Oh, thanks for that great news.
Well, from a vein standpoint. So rather than having to go through that, it'd be better to correct them first.
Really?
Yes, and a lot of the procedures we do now, they're all just done with local anesthesia. So even if you're still breastfeeding, it's still good, safe to do.
Very good. Okay, so maybe somebody is interested, maybe thinking, maybe I need to get this checked out. You have an event coming up, a screening?
Yes. We have a vein screening coming up May 20th and 21st. We'd be happy to take a look at anyone who has any questions or problems.
Okay, and there's your address there in Mechanicsburg area, and you do want folks to call and make a reservation for that?
Yes, please do.
Okay, very good, very fascinating information. Thank you, David.
You're welcome,
Calcagno.
thank you. We have a vein screening coming up May 20th and 21st. We'd be happy to take a look at anyone who has any questions or problems.
Okay, and there's your address there in Mechanicsburg area, and you do want folks to call and make a reservation for that?
Yes, please do.
Okay, very good, very fascinating information.